Yes. All right. So, as we like to say, talk to me.
Yeah, so I guess it started like 2 years ago. I injured my back. Well, started getting like low grade back pain, and knee pain. And
Mhm.
then like started kind of getting PT for both, and then went through about a year of PT for my knee. And
Mhm.
then got discovered on an MRI that I had a bone fragment in my patella tendon. So I had a,
You had a bone fragment in your patellar tendon. Wow.
yeah, so then I had the first surgery taking out that bone fragment. And
Mhm.
then like a couple months rehab, really wasn't getting better. Then I got another MRI, and my tendon still like degenerated down the middle. So I got the patellar tendon graft surgery with the piece of my hamstring,
Mm.
and that was in August 17th, 2012. And then after
Mhm.
that, I don't know. After that, my back started really hurting, um, and obviously my knee was post-surgical. But since then, my knee's probably where it was before the surgery. Um,
Mhm.
and my back is still very bad. Like if I lift things, or it gets real tight. Um, and then it's just tight. And whenever I stretch, it's like sharp pain.
Yeah. Well, stretching doesn't work anyway. Well, you can't forcibly elongate something that's actively contracting. The back is easy. For that matter, the aftermath of the patellar surgery is easy. What's going to be a little uh, not as usual as the hamstring that they took the graft from, because that almost certainly prompted a contraction through the hamstring,
Yeah,
which in fact may be what triggered your back, because those are connected reflexively through the pattern that has to do with standing and walking.
yeah, but yeah, I guess. But my hamstrings are like super, super loose. Like I can put my palms down on the ground, no problem.
Do your feet both point straight forwardly
When I'm like resting,
when you're standing?
no, they point outward.
Then your hamstrings aren't free. I mean, you've got a contraction pattern that's pulling the hamstring off to the side.
Yeah. Also,
Tightness and looseness are kind of a crude marker. It's actually how a person coordinates movement, and that's not the same as static. But if the feet turn out, that shows that you've got a pull that's turning the feet out. The natural position of the feet is pointing straight forwardly, something that's almost never seen in people because people are so tight in this culture.
yeah. Yeah, and another thing is, I guess 2 years ago I pulled a muscle playing soccer in my groin or
Hmm.
stomach, just like up in that, like a little more towards the middle than the hip flexor, but just like up in that psoas region,
Yeah.
and that's never healed. And that's why I've been doing the Free Your Psoas program.
Okay.
And I've gotten like modest results, but still
Well,
like,
that's not the primary issue. That's not the primary issue. You've got to. Sounds like you've got to deal with the primary issue first, and then go after the psoas. If you're not getting good results from a program or from an exercise, either you're not doing it correctly or it's the wrong one for you.
hmm
Because these exercises work very quickly. Like 2 practice sessions is enough to feel significant change, and something around 7 gets the whole thing done.
yeah, I guess I just haven't hit it then. Um,
Yeah.
I mean, with that, it's kind of like, it's really like my one motion that I don't have is hip extension, I guess. Yeah, hip
Yeah.
extension, especially on my left hip.
Hmm.
And like I can't, that's like it's a big deal. Like it affects me when I walk, when I take a stride with my right leg. Like I'll kind of like, I don't know, it won't be loose, so like jolt me around when I pull my left leg back. You know what I mean?
Yeah. Right.
So that's kind of like it's a big issue. And
Right.
stretching my hips doesn't do anything.
Right. Yeah. So you discovered that.
Yeah.
How far are you in the SOAS program?
I'm on like my third go round of the, the fourth lesson, the one where you're lying on your back and
Hmm.
lifting your one hip.
Okay. Well,
before.
if you didn't get the result of what came earlier, you need to go back and abandon the fourth one because you're not ready for it. And so let me hear how it went with the one called Walking into the Floor.
Yeah. So with that one, it's like when I push my left knee and foot into the floor, it will kind of give me like a vibration feeling through like my right here, which I'll get like if I take like a deep breath. I was also getting that a lot during the first one, the finding center breathing, like when I was moving the air up.
Yeah.
And it made it feel better, but only for like 10, 15 minutes after the lesson.
And then you tightened up again.
Yes.
Okay. How many cycles did you go through that lesson?
I like that one a lot, so I probably
Yeah.
15 times.
Well, that's way more than you should have needed. What about the one preceding called Slide and Turn? Do you remember that one?
Slide and turn, yeah, probably done that one 7 times. Slide and turn. Are you on your... Which one is that?
You're lying on your back. One leg is straight, the other leg is bent at the knee. You put the foot on top of the straight leg.
Right, yeah.
And you slide along your leg back.
That one didn't give me that much. For some reason, like I was able to get better at it.
Yeah.
But it didn't relieve anything.
It's not supposed to. It's a preparatory move. It's supposed to clear the decks, clear out contraction in the hip flexors, particularly not the hip flexors, the adductors, that's the inner thigh muscles, and the external rotators, the buttock muscles. Because when those are tight, they interfere with the straightforward movement of the hip flexors and psoas, and so you don't get a clean perception. So we do that one first. And was that pain free for you?
Pretty much, yeah.
Yeah, okay. And you said you got better at it.
Yeah.
Okay, let me take a pause here and reflect for a second. Okay, when you did Walking into the Floor, did you roll your leg to aim into the least comfortable position?
Yes. And when I'm rolling my leg, I'll roll into the place that vibration, like once I hit the spot, once I roll into the proper working position, I'll get that like kind of like a vibration like release feeling. Every time though, that's the thing, like it feels good when it happens. But then like if I go and decrease the space like between my rib and hip, then it'll like reset, and then if I bring it up again, it'll do that kind of crunching noise again. So I don't know.
Where's the crunchy noise?
Like kind of just left my belly button, maybe a little lower.
Wow, I didn't know there was anything in there that could crunch.
Yeah, it's like it's odd. I don't know.
Yeah, it is odd.
And also like I can't push my belly out very far anymore. Like I feel resistance when I push my belly out.
That's in fact that I was leading up to that. I want to see you take a big breath and see what that looks like. You may be just so contracted through the abdominals that you need to deal with that first. So would you stand up, make sure look in your monitor so you see what I'm seeing, and then aim in. Let me watch you take 2 full breaths. And we need to move so the light isn't behind you, because that causes us to drown out the image. That looks better.
That good?
All right. Yeah, just let your arms hang. Don't hold. Well, if you hold them out, that's a sign right there. But show me 2 breaths. Okay, so you're tight through your whole right side in your breathing. If you watch yourself, you'll see that you curve a little to the right when you inhale. The right side doesn't expand as much as the left. Yeah. Okay.
Yeah.
Can you sense that?
A little bit. Yeah, kind of right.
Yeah. Okay. And since you're up, may I watch you hang down, see what you look like when you droop forward?
Like this?
Yeah, but do it on camera.
Let me get this chair out of the way. You got it?
I think that'll show me enough, yeah. And just turn sideways to the camera. There we go. All right. I see you're not letting your head hang also. Is that a stretch to you, or is that just easy?
It's pretty easy.
Because I see your knees are bent as you're doing that.
Mm-hmm.
Yeah. Okay.
It's kind of more of a stretch.
That's all.
My calves.
Hmm?
More of a stretch in my calves than the hamstrings.
In your calf. Yeah. Okay. Have you done the hamstring maneuver that I've published?
Yeah. With that, like, it's more of a stretch, like, when it's the back thing to me. I don't know. It bothers my back.
Okay. Yeah, that's okay. That is another sign. So there's nothing in this OS program that's going to free your back or your waist. It's not made for that.
Uh-huh.
But you're obviously tight in your back.
Yeah.
And tight in the front.
Yep.
And tight in the side, on your right side. Looks like you need to do the cat stretch exercises as preparation. Because your trunk is in a state of contraction. And muscles don't operate like machined objects, like there's independent. They're all connected reflexively through your nervous system. So it's more accurate to think in terms of movement patterns than muscles. Oh, by the way, pause right there. Just look in the monitor. Notice your head position.
Yeah, somewhere right.
See, so your right side is tight.
Yeah.
See, and when you try to go left, there's a pull that doesn't want you to go that way.
Yeah.
Yeah. It sounds like you need to do the cat stretch program as preparation.
Okay.
Okay. It's really unusual for a person to have 15 minutes of relief and recontract unless the place that's tightening is part of a larger pattern. In this case, it would be your frontal, your abdominal, your front aspect.
Mm-hmm.
Okay. So it sounds like you need to be doing the cat stretch program. That'll free you of that stuff, and you will start to, your breath, for one thing, will increase quite substantially. And the urge to close up your front.
Does the cat stretch exercise deal with the abdomen?
Yes, number 2 does.
Number 2 does, okay.
Yeah, number 1 deals with the back, number 2 deals with the front, number 3 deals with the sides. And then 4, 5, and 6 deal with twisting at the hips, waist, and shoulders and neck.
Okay.
And then breathing and walking are the last 2. What I'm considering here is that the thing that's happening with your hip flexors is part of the larger pattern of tightening in your front.
Mm-hmm.
Okay. And they're just, in effect, you might say, a servant of that larger pattern. If the larger pattern is in place, you're just going to end up reinstating the small part that you've changed.
Right.
Okay. I'm going to ponder for a second here. Yeah, that feels right. Seems like that when you get to lesson 2, you're going to get substantial changes. Then when you go into the movements for the psoas program, you'll be much more effective.
Mm-hmm.
It's only because you're out of the curling forward movement.
Right. Okay. Okay. But the only thing, yeah, I guess, the only thing that's in my mind is that, I don't know, like it was when I pulled that muscle in my groin, it was like a very specific, like it was a pull, and like that only, it's a small, very small, like muscle or small area of pain, and it's like, I don't know, it's very like specific movements that's gonna trigger it, and it's not
Can
like
you show me?
yeah. Actually,
Let's see what those specific movements are. Make sure, again, look into your monitor. Make sure I can see what you want me to see.
okay. So if I go in like a hip flexor stretch,
Yeah.
and then move this leg in like a external rotation, I guess.
Yeah.
And then kind of some position right there, and then kind of like go this way and forward.
Yeah, okay, so it's the left side where you feel that.
Right in there.
Mm-hmm.
It's every time.
Now, with your right hand, if you stroke sideways across that place, do you feel like a strap, a sideways movement? Don't move. Don't do a stretch of it. Just stroke across with your hand and see if you can feel like a twangable string.
I can't get there. No, I've tried so much.
Now, what do you feel there? I'm seeing that it's all hard and contracted. Looks like your flexors are tight. I'm looking for whether you can sense your own psoas tendon there. When it's taut, it stands out, and one can stroke it like a guitar string. It twangs. If you can't reach it, it's because something else is in the way. Yeah, that's not the psoas tendon's a little further in, but you're working on the hip flexors. Okay. Well, you've got the right technique for locating it. You change position in order to get into different places.
Yeah.
Now, the real question is, why did that muscle pull happen to begin with?
I didn't stretch before I played.
Yeah, that's long. If it were, your right side would have gone also.
I guess so. I mean, it was probably... I don't know. I kind of, on that day, I had worked out my, core region the day before.
Mm-hmm. Doing what?
And I played, just doing, leg lifts, sit-ups type things.
I see. Yeah, so you were practicing tightening your front.
Yes. Yeah.
Oh, well, that fits the pattern.
Yeah.
Yeah.
My views.
The only thing is, again, you did both sides, and only the left side went into contraction. So that means something happened earlier than that to your left side to get you tighter to begin with, or you would not have gone into contraction that way on the left side only. It would have been both sides if you treated both sides the same way.
Yeah.
You had an injury to that side?
Before then?
Way before then.
I don't know. I've pulled both hip flexors a lot over the years, but no more on my left than my right.
Okay, I'm looking for something that happened in your left side. Could have been an ankle sprain, something that made you want to stay off that foot.
Oh, my left knee was.
Oh, okay, yeah, right. Yeah, well, guess what surgery does? See, it puts you into a contraction pattern.
Yeah, that was before surgery. But
what the question is, what made that bone fragment form in the patellar tendon?
Osgood-Schlatter, tight quads.
Yeah, well, that's a name, but it's not an explanation. Okay. Anyway, they went into the tendon, made an incision. They took out the bony, I think it was a growth. I don't think it was a fragment. I think it was a growth in the tendon.
There were actually, there was both. That growth, I think they call it somalia or something like that. That was there. They shaved that away. And that was kind of rubbing on the tendon. It was kind of growing from beneath the tendon. And then they took out another piece that was embedded in the tendon. Yeah, where that piece was from wasn't necessarily my tuberosity. It could have been from that growth that was beneath the tendon.
I think it's from the growth. I mean, unless you had a hard fall on the, no, that doesn't even make sense. You know, if you had a fall and a fracture and you broke off a bone fragment and it migrated and embedded itself, that's the scenario that I have to apply for that to be the explanation.
Yeah.
Really doubtful. Unlikely. I think, again, it was a deposition of bone cells that grew into those embedded pieces of bone. In any case, it kind of doesn't. It's useful if we're going to be doing detective work, which is what I'm doing right now.
Yeah. What else may be useful? I mean, for the past, I guess, 4 years, I've been just horribly injury prone for some reason. So I've had also ankle surgery. And
Same leg?
No, on my right side.
On your right side. Okay.
And shoulder surgery on my right labrum.
Right labrum.
Yeah, my shoulder labrum, the back of it.
Mm.
Which healed well. My shoulder feels good. And I also separated my left shoulder about a year ago, falling off a bike.
Oh, well. Okay, so the cat stretch exercises are in order for you. They cover a lot of bases. What happened to your right labrum that made surgery necessary? That's another question. What was your injury?
To the ankle?
No, the shoulder.
Oh, the shoulder? It was like a frayed piece of labrum on the posterior side of the capsule.
Well, sure, that's what they corrected, but it doesn't say what caused it.
No, it's a mystery what caused it.
Okay. Generally, it would be that you have muscle pulls at the back end of the shoulder that are pulling the head of the humerus, as upper arm bone, backward. It's not allowing that head to stay centered in the joint. So it's being hard pulled backward, and then every movement grinds away at the labrum because it's off center.
Mm-hmm. Mm-hmm.
And that points to having an injury. It could be a hard fall on the shoulder, athletic injury, something you tightened up there. Again, it's not both sides, so it's something that happened on the right side.
Yeah, I mean, it could be tons of things. I don't know. I've had hard falls on. It's just a lot of soccer, I guess, so it could be in.
Okay. All right. Right, okay. So there's some what we call cleanup to do.
Yeah, I think, I don't know. I ever since, starting these programs about a month ago, I'm feeling more and more of what's going on, and I don't know, I just feel pretty off.
Yeah. Okay.
So.
Well, it sure looks like my recommendation keeps getting reinforced. Do the cat stretch program from beginning to end, and then go after the hip flexors. Because you've got a whole bunch of stuff going on. The left shoulder separation, the right shoulder contractions and surgery for the labrum, the left knee removal of the bone, and the right ankle surgery, which, by the way, tell me about that.
That was just repeated ankle sprains, and then it wasn't healing on the last one. Kept being sore whenever I'd run on it. And then they just did surgery just to see what was going on, and it was just like a ganglion putting pressure on a nerve. So they just took that out, and it was better.
Okay. Well, the ankle sprains happen when the ankle and foot are unstable and don't meet the ground in a level way.
Yeah, I also wear orthotics because my ankle's pronate. So I've been wearing.
Oh, well, then, okay.
I was like, 12.
See, new piece of information. Big deal here.
That's a big deal.
See, here's what's so. If the feet don't meet the ground in a level way, and since balances are imperative in movement, the upper muscles, generally around the hip, tighten up to keep the leg in a straightforward moving position. If you pronate too much, the knee turns in. If you're supinated, the opposite, then the knee turns out. So those hip flexors in the front and the external rotators in the back are in a kind of a chronic balanced power struggle to keep you stable so you don't lose your balance. So it's very important to correct the feet. When you do the hamstrings movements, you do it flat foot without any footwear on.
Of course.
Okay, great. Okay, I just thought of what I'm going to have you do here. You're going to do the straight leg integration moves. Make a note here. You can start that one right away. It's a free download, or it's rather video on YouTube. And
what's it called?
Straight leg integration. I don't imagine there's any video on all of YouTube with the same title. But you might have to put it in quotation marks to get an exact match.
Sure. So let's talk about the intensive program.
Okay. You have a starting point of questioning?
When can I start?
Oh, okay. Well, I'm in a situation where I'm relocating, so that I'm not going to be starting with anybody new until mid-June.
Okay.
However, I think you'll get a great deal from the straight leg integration. It's going to deal with a ton of stuff.
Okay. But yeah. Sure. I mean, so do you recommend that I start with the cat stretch or the straight leg integration first?
I would say start with the straight leg integration right away until you get the cat stretch program in hand. Let me ponder for a second here. In general, I recommend that people have done the cat stretch program before straight leg integration because there are movements that you need to know and to be able to do. You need to know the feel of them. And those you learn in the cat stretch program, particularly in lesson 3 of that program, where you're dealing with the sides of the body, because straight leg integration involves a lot of stuff in the sides. It also involves the movements of rotation of the legs. That's twisting. And that's lesson 4 of the cat stretch exercises. So I would say, though, for immediacy, start straight leg integration. You get what you can from it. You'll see how it affects you. If you start getting real big changes and you just want to milk it for all it's worth, do that. If you find that you get some change but it's not all that much, or it isn't a durable change, then you'll need to do the cat stretch exercises to prepare you so that you get the best result from it, which I've, by the way, put into the description underneath the video on YouTube. I tell people these things.
Mm-hmm. Okay. Yeah, I've seen that. Okay.
Anything more about the intensive thing? What kind of questions you got?
Besides the date, because I have to buy plane tickets.
Okay. Well, I can notify you when my situation stabilizes.
Okay.
I don't want to commit to anything that I can't fulfill because I haven't stabilized my situation.
Yeah.
So I just have to take that into account. Anything else about time or anything else?
Yeah. After I do the intensive program, if I make, let's say I make a lot of progress during those 5 days, I would like to get back to doing woodworking, which I can't do at all right now. And would I be able to do that after I get those changes from the intensive program, or would I have to rest for like...
No, rest is the last thing. What you do is you put into action the changes. You reinforce the changes by using them. So that means you should be doing walking. In fact, after every somatic exercise practice session, it's a good idea to take, say, a 10 to 20 minute walk.
Yeah.
And it integrates the changes into your overall movement patterns.
Okay. So
once you're through this, you should be able to do anything.
That'd be amazing. That you don't even. I've been. I would like to get back to doing things. Go on.
I was just asking any other questions.
I can't hear you well right now, but I heard that. I don't have any more questions about the intensive program, I guess.
Yeah, I think I put answers to
I think your mic's off.
Hmm?
Your mic is off, I think.
Oh, it is.
Your microphone.
Yeah, I know.
I can't hear you.
It's on. You're not hearing me now?
I got you now. Hold on, let me turn my volume up.
I have no idea what changed.
I got you.
Okay. All right.
Yeah. So about the intensive, I don't have any more questions. Just time frame. I'm just kind of I really want to get better as fast as possible because it's been so long.
Yeah. Have you done the exercise I called free them hamstrings?
Is that one like 7 minutes?
Gosh, it might be. It's done sitting with your legs in forward of you and you're gripping on a foot.
I haven't done that one.
Okay, very important. You had surgery in your patella tendon, which is the tendon of the front thigh muscles called the quadriceps.
Yeah.
And as I said, surgery provokes contractions. And those muscles, the three large ones, wrap around the femur, the thigh bone, and go converging into the patellar tendon, land below the knee. But the fourth is called the femoris rectus. That's a central muscle of the front thigh, and it crosses the hip joint at the top and then attaches below the knee at the bottom. And when a person is wounded in that place, the person wants to protect their whole knee, and they kind of lift the foot off and use the hip flexors. So if you're in that reflex pattern from the surgery, you want to clear that up. And the one called Free Them Hamstrings is the one to use. So I'll send you a link to that.
Yeah, I've already got it.
You got it already?
Yeah.
Okay, you're on my YouTube channel then?
I am.
Okay, so you've located straight leg integration and Free Them Hamstrings?
Correct.
All right, I don't need to send links to you for that. And I think it'll be very interesting when you do those movements. I think you'll get some very interesting changes, and I'd like to hear, after a few days of practice, what changed in you.
Okay. Sure.
Now, just a word about straight leg integration. It's a relatively long lesson. It's over 30 minutes. And halfway through, because it's long, I put a halfway point marker and a link to an exercise which helps with the lower leg, ankle, and foot called the Athlete's Prayer for Loose Calves. There's a clickable link in that video.
Okay.
So you go to that exercise midway through, go through it, and then return to the straight leg integration and pick up where you left off.
Okay.
Okay. So, I can't think of anything else. Anything from your end?
No.
No.
Oh yeah, I mean I've seen Bagusha a couple times, 3 times.
Yeah.
But with her, again, it's like the same thing. It's like feel good for maybe 2 hours, and then I go to do something, and I seem to just go back into like a pattern that causes pain. So it's not giving me lasting results at all.
Yeah. Okay. It has to do, sounds like, with not yet having done the thing that's needed. The first 2 lessons are usually general lessons to reduce overall tension. I don't know, Bagusha works in some interesting ways. I've been at her, actually I was there at her clinic for a month as a guest practitioner, and I taught her staff some. And usually the first lesson is done lying on your front, and it involves freeing the muscles of your back. That's the usual starting point. Does that sound familiar?
Yeah, that was the first lesson. And then like we talked about these things, and we did get more specific into like the abdominal tension and the obliques.
Okay.
And doing some like right leg lying on your back, right leg bent, left leg straight, pushing your left hip into the ground and your right shoulder blade, your head. So kind of like a...
Yeah, that's twist stuff. Yeah.
And
Okay, so she hasn't done with you anything that deals with the aftermath of the knee surgery?
No, not really.
Okay. Well, you just haven't. So if you were to continue with her, you would probably get to that. But there's certain stuff that we do at the outset. And it sounds to me like she was dealing with just the first two basic lessons that we do, back of the body and the trauma reflex, which involves a twist that occurs in a person.
Mm-hmm.
Okay. Bagusha is effective. She's one of the good people doing this work. It's just a matter of having gone far enough along in your sessions to get to the stuff. You can't get everything done at once. Generally, we start with particular opening moves, so to speak. And it sounds like that's what she's done.
Mm-hmm.
And you could always invite her to include me in the process. She could phone me up. We talk from time to time.
Okay.
Yeah. But you've got what you start with, the straight leg integration and free them hamstrings. Go through those, and then let's see how that goes. I think it's going to be interesting.
All right. I'll let you know.
All right. And I'll let you know when my schedule stabilizes, when I'm taking anybody new.
Thanks.
All right. And then I can give you a downloadable version of this video if you like.
YouTube's fine.
Nah?
YouTube's fine.
YouTube is... you mean mount this on YouTube and have you view it on YouTube? Is that what you're saying?
This video itself? Sure.
Yeah, this video. It's up to you. I make these videos available to people so that they can have a refresher or repeat if they need to review what was said.
Why not? Yeah.
Okay. So if I do it on YouTube, I can make it a private channel. I don't know that this is going to be of much interest to the general public.
Probably not.
To other practitioners, yeah, because it's like, how do we do detective work when something is mysterious? So some of the newer practitioners would find it useful, but the general public is probably going to move on really quickly if they start this one.
Yeah, whatever you want to do, that's fine.
All right, okay. So I'll attend to that once we finish this call. And then you've got what to do, and we'll pick up from there when we're ready for that.
All right. Thanks.
Okay. And let's see. I'll put a link in an email message to the cat stretch exercises.
I've already got them.
Oh, great. All right, then. So unless there's anything more, let's sign off, and we'll connect later when you've got something to report.
All right. Nice meeting you.
All right, Kevin.
Yeah.